Hi, my name is Dr. Brooke Worster, and I'm a physician researcher at Sidney Kimmel Comprehensive Cancer Center at Jefferson Health and the chief medical advisor for Ethos Cannabis.
Hi, I'm Emily Hajjar, and I'm a clinical pharmacist. I work with older adults in supportive oncology, and I'm also a professor in the College of Pharmacy.
We are here and interested in talking about a new study that came out in early February 2026, and it looked at lifetime cannabis use, brain volumes, cognitive and memory function in older adults. I think it shows that there's an association, and not that it improves brain health, but it might be protective against some of the loss of brain health. And so that's an important way to look at things, right? It's not that if you go out there and smoke a whole lot of cannabis, you're going to be smarter. That's not what this is saying. It's saying that maybe kind of moderate use of cannabis over the course of a lifetime might prevent some of those things that everybody fears that we're going to kind of lose or get less kind of cognitively acute at as we age.
People that use cannabis tend to have higher alcohol and tobacco exposure as well. But they really didn't comment about education. They didn't comment about diet or lifestyle. And we know that some of those factors do have impact on cognition as well. So again, I think more data points to be collected or studied, for points going forward in the next study.
Yeah, and it's helpful that it was such a large number of people, over 25,000. And so not being able to account for all of those, the dietary differences, the socioeconomic differences, all of that, in such a large sample tends to not be as big of a deal because we're not as worried about it being a biased kind of sample because it's a large number of people. But they didn't and weren't able to specifically comment about any of those other kind of factors that certainly influence memory impairment and cognitive loss as we age. I think it's kind of a cool idea to say, we know that there's some areas of your brain that have a whole lot of these CB1 receptors, which is where cannabis is active at. And if we stimulate those receptors over time in some way, does it kind of keep them more fit? Does it keep them more plump, more present, more active than if we're not stimulating them at all?
My takeaway is moderate use over the lifespan is a potential neuroprotective effect. But I, really do want to point out that this doesn't say more is better. And so it's really that moderate thing. And for me, again, it might remove barriers for people that want to or have this fear for later life.
I love that idea. To me, it's if this removes some of the stigma or a barrier for you as an older adult to think about using cannabis for pain, for insomnia, for anxiety, then that's a good thing, it looks like. And maybe this will enable you to talk to your physician about it, talk to, informed family member, talk to even kind of the staff and the pharmacists that are at your dispensary. If it removes one of those barriers to you feeling comfortable having those conversations and maybe trying this out as a tool that could be helpful, then that's a good thing.